Joining us now is the Auditor General of Canada, Karen Hogan. Great to have you on the program, and it's a fascinating series of reports, this report card. Canada had threats from viruses before. You know, we've had H1N1, SARS, and yet in this report, you and your team conclude, quote, the Public Health Agency of Canada, quote, underestimated the potential impact of COVID-19, was not adequately prepared. What went wrong? What did you find?
It's nice to be here, Evan. Thanks for having me. I think you've summarized it well. What we found is that they weren't as prepared as they could have been for a pandemic of this magnitude. And I would summarize that in really four quick areas. There was emergency and health plans that were not up to date. And more importantly, the federal, provincial, and territorial response plan hadn't been tested. The agency had not addressed longstanding issues in information sharing with the provinces or updated its IT system in order to support the sharing of that information. A risk assessment tool used by the agency was not designed for pandemics. And then finally, they hadn't contemplated or weren't prepared to respond and enforce a nationwide quarantine like the one we've been living through.
Let's unpack that again. The early warning system, and we've talked a lot about that on this program. You said you found it wasn't working. Can you tell people what the early warning system was and what happened there?
So the Global Public Health Intelligence Network really issues two reports. It issues a daily report and an alert. The daily report was issued at the end of December and contained a link to an article about a virus that would then become known as the virus to cause COVID-19, but an alert hadn't been issued. And an alert is important because it signals something unusual, something that really makes you stop and consider whether or not you need to respond to it. Alerts had been issued in the past from the H1N1 and SARS a health crisis. We'd seen them used, and it really was unclear for us why that alert had not been issued.
Yeah, the alert not issued. That's a big deal. In fact, they dismantled that, and then they had to put it back together. You also found enforcing mandatory quarantine measures at the border and points of entry are crucial to limiting the spread of the coronavirus, but it seems like there's a lot of inconsistency there. There was no follow-ups. What happened at the border?
So I'll start with the positive that we saw at the border really was that the Canada Border Service Agency and the Public Health Agency of Canada worked well together to design guidance for border service officers in order to implement exemptions and to provide information to travelers as they entered the country. What we saw, however, was that the agency was not well prepared to enforce a quarantine of this magnitude. While they recognized that they lacked some capacity and sought some additional help, we found that they were not unable to conclude whether 2/3 of travelers had actually followed the requirements of the 14-day mandatory quarantine.
That's a lot, 2/3 of travelers. That's significant. Just because there's so much to get through here. You looked into the emergency wage subsidy and the emergency response benefit, hugely popular programs, but you concluded that the government prioritized speed over implementing controls to vet out things like ineligible recipients. And it might be more costly to audit and recover overpayments. So we knew they were getting the money out fast, but what was the cost of doing it?
So our audits on both the Canada Emergency Wage Subsidy and the Canada Emergency Response Benefit didn't really look at the costs. We have 2 more audits planned that will really take a look at post-payment controls and whether any payments were made in error and if recoveries are taking place. What we did look at here was whether or not the program was designed and rolled out in a fashion that supported the need to respond to individuals and businesses in a timely way. And we saw that. And that balance is really an international best practice where in an emergency situation, you put some greater emphasis on post-payment controls than those ahead of the payment.
Okay, finally you wrote, I thought this was such a telling statement, we will never be able to tell Canadians what would have happened if the preparedness issues had been better addressed before the pandemic hit and if all plans had been updated and tested as they need to be. Perhaps the government's pandemic response would have been different. Obviously, it's hypothetical, but do we know, I mean, with the lack of preparedness, the lack of warnings, and some of the things you highlight, do you suspect it would have been quite different and maybe the government would have not only responded differently, but more quickly?
I do think that it's important to place a lot of value on being prepared. Even prevention has a value that all too often we overlook. And here we just won't know really if an alert having been issued or if plans had been tested, if obstacles would have been identified before the pandemic, that would have changed the response. So I do think that's why, and I recommend that an independent review happen across the country about the pandemic response. As a federal auditor general, I can only look at federal programs and federal spending. And so someone who has a broader outreach should really be looking at that to inform what our approach might be countrywide the next time.
Well, this is the first deep dive into that, at least that first 6 months. Tremendous work. Auditor General of Canada, Karen Hogan, thank you so much for your work. I appreciate the report.
Thank you for having me.